Okay, welcome back to another sports massage therapy education video. We're looking at the rotator cuff group today. So, before you do any kind of rotator cuff work, you need to understand what the anatomy is of the rotator cuff. So, first thing we're going to do is find that scapula. So, at the moment here, obviously we've got that inferior angle, following up that medial border until we get to the top. And first thing I'm going to look for is the spine of the scapula. The reason for that is what I want to find is the first rotator cuff muscle, which is going to be the infraspinatus, which sits just above the spine of the scapula. Underneath that, you're going to have the infraspinatus. Again, think you've got supraspinatus, infraspinatus, so your superior, your inferior. And then just underneath that, we've then got the teres minor. These are going to be the three main ones of the four that we're going to be looking to massage. The reason I say that is the subscapularis sits on the reverse side of the scapula. So for us to be able to get to it as masseuses, it's near on impossible. So we're only really going to focus on these three. Okay, so I'd like to always start. You want to get a nice, good amount of effleurage in on the area. And again, we're looking for some good erythema, so getting that blood to the surface, and we'll notice that by the skin going red. Alternatively, you want to base it on heat. So once you start feeling that warmth in the muscle, then we can start moving on to some of the more advanced techniques. And again, I like to always work out towards the shoulder here because you've got those axillary lymph nodes just around that armpit region. It's just a nice way to get that flow in. Okay, what we can then start to do is get a bit of Petrissage done in the area. It's completely up to you how you want to do this. You can come in, we can do a little bit of that kneading. Personally, I prefer a nice ringing technique, just really kind of getting in, stretching the area out. And I find it's quite nice to go with the fibers of the rotator cuffs because it's almost like you're kind of stripping across that and getting a nice stretch. And then I like to just almost kind of get in and do like a one-hand knead as well. So as I come in, I tend to kind of push in onto that side as I mentioned earlier, and then using the palms just here, just to get a good amount of pressure and just work through that area. Okay, so the first one I want to do is I want to get in, and again, we're going to palpate that area. So find that shoulder blade, that medial border. So we come up just in here. So I want to get to that supraspinatus first. So I like to just do a bit of gentle work, working your way through. I tend to just kind of use my thumb as I come in across that, feeling for any kind of tension that there may be in there. And as we kind of come across, the client is holding a little bit of tension more towards this medial border actually. So what I'm going to try and do is, again, I'm going to try and use both my thumbs here, and just a gentle strip. Keep it nice and slow and controlled with this one. Finding that point again, working our way across. And as that tension starts to ease off, I will ease my pressure off as well. Perfect. And once we're happy with that, we can start coming down onto the infraspinatus now. So we're going the opposite side now of that spine of the scapula. So becoming more inferior, hence where the name infraspinatus comes from. And again, similar technique. I like to just kind of really work in, slowly stripping across towards the shoulder. One thing to note, if your client came in with a rotator cuff injury, this is probably going to be excruciating. So I tend to do this more if it's maintenance work with the client. So we're just dealing with kind of general aches and pains rather than if this was an injury. And again, if it was an injury, make sure you do your assessments, really find out which one is causing the problem. So that's where you're going to really want to understand kind of your, I suppose, your joint actions and the actions of each of those muscles as well, to know which one is responsible or which one is injured, shall I say. And then just coming down now, so more on that lower end of that medial border. Again, we're going to have now the teres minor. So the teres minor is actually going to be pretty much next to the teres major. So you want to make sure that you have actually got the right area here. One thing I like to do is I like to use 3 fingers now as I'm getting towards the bottom. Similar technique I did with the thumbs, and just really work it all the way down. And oh, hello. So that just through here, we've got a little bit of tension. So I'm going to go nice and slow now. Good amount of pressure, how's that? So it's just as we kind of get to here. Okay, we can give that one more go. There we go. Just really working that. And you'll start to feel it give up. Once you've found that tight spot, that pressure will start to ease off. So again, obviously it's just work out where we are with that shoulder blade, that scapula there. And then to finish it off, it's just nice just to kind of go over the whole area, knead it back out again as you're kind of going towards that axillary lymph node, flush anything out. Perfect. And just a couple of things you could do. So in a hypothetical situation, let's just say you found some adhesions up on here. You could go in and you could maybe kind of pinpoint it with some of those transverse frictions. You might want to get in, just do kind of a standard friction up on that area as well and start applying some of those level 4 techniques. But what I'm going to do now is show you a nice little passive stretch that we can do on this rotator cuff group. Okay, so one of the stretches we can do is bringing the arm down. We want to find that natural point of resistance. So if somebody had real limited mobility, they'd probably find they're only going to get to about here. And the one thing we want to bear in mind is we don't just want to move the arm around. We want to make sure that we're actually supporting that shoulder and bringing it down. And then what I'm going to do is I'm going to place my hand on top of yours. And all I'm going to get you to do is resist against me, okay? So we're going into like a bit of an isometric contraction. So if you can push against my hand, and I'll push against yours, and we're going to hold normally for around 10 seconds. So just keep that pressure on. 7, 8, 9, 10. And relax. And again, give it a little move around. You can go a little bit lower. You would then do the same thing. You're going to repeat. So you could potentially be going from here to here to here to here to test that mobility has got to a good range where it's going to be healthy for the client. Okay, one of the techniques I like to do just around the shoulder blade here is I like to use my knuckles a little bit. It's very similar to if you're using like a gua sha blade. But again, we're going to focus just on these rotator cuffs. But what I like to do is almost just like a back and forth motion. I just find it really helps to kind of get in there. If there are any little adhesions, it helps to just kind of break them down a little bit. But it's very good at getting that erythema to the area, gets it nice and warm. And like I say, for me, I just find it really helps to break down if there's any adhesions in that area. So, nice little technique that I like to use, something you might want to take away. Okay, another technique I like to do with the clients now is to get them to work with me. So what I'm going to ask the client to do is bring their arm up for me. So if you can bring that all the way around, perfect, so we get to about there. What I'm going to do now is as I'm working down through that, I'm going to get the client to bring their arm through that rotation as far back as they can. So try and go at the same pace as me. So off we go, bringing it all the way down, as far back as we can. Perfect. Coming back round again. Let's do the same. And off we go. Applying that pressure, working with that rotation, and easing off. Bring it round. Let's do 2 more of these. Off we go. Go more for a clenched fist now, really getting in there. Perfect. Let's go for one more. Off we go. All the way back. Perfect. And then relax. And then again, really get in there. Work it as much as we can with that kneading. So one thing you want to bear in mind is obviously muscles tend to work a bit of like a chain reaction. If these are tight, it can cause issues in the shoulder. It might be coming up onto the neck. So when doing rotator cuffs, I always find it really good anyway to really kind of get in, working the traps up to the neck, also work on that shoulder mobility as well. So don't just kind of focus on that one area. If you want to get the best results, have a look and start working those other areas as well. Okay, to finish off now, I find just a cross-directional stretch a nice way to kind of really alleviate any final tension, pushing in opposite directions. So you can do it this way, you might want to push that way and across here. It just depends, whatever is comfortable for you. What I am going to do though, is just dab some of that oil off, just so I can get a little bit of a better grip as we do this one, because in order to really kind of stretch it out, we need to be able to get a grip on the tissue. So again, there we go, much better. Really just give them a nice little stretch. Okay, we're going to go for a push and a pull. Perfect. Last one. Excellent. And there we go. And that's how I would personally look at the rotator cuff group. Again, not specific if it was an injury. This is just purely from a maintenance point of view. If I had a client come in, a little bit of tension in the area, these are the techniques that I would use to alleviate that tension. And that, ladies and gentlemen, is going to be a wrap on another video. So I hope there were some techniques, maybe some different styles, the ways that I do things that could be useful for you to take away. Again, just remember, every therapist has got their own way of doing things. So hopefully, like I say, there is something there that interests you, that you can take away that's going to help you with your clients. And as always, don't forget to like, comment and subscribe, because if you remember, 99% of you guys watching right now are not subscribed to the channel. So if you are enjoying the content, you're learning something from it, to help support me, hit that subscribe button. And as always, I will see you in the next one.